My name is Dawn Contreras. I'm an Extension Specialist at Michigan State University Extension, and I want to welcome you to our webinar today on measles and vaccine hesitancy. Our webinar today is brought to you by MSU Extension's Michigan Vaccine Program and funded by the Michigan Department of Health and Human Services. So today we have two very special guest speakers that are joining us, and I'd like to introduce them very briefly, and then they'll give more of an introduction as they do their comments. So we have Dr. Hoag here. Dr. Hoag is the professor at the MSU Biomedical Laboratory Diagnostics Program and the Department of Microbiology, Genetics, and Immunology. We also have Dr. Susarla today, and Dr. Susarla is an Omura-Saxena professor in responsible AI from the MSU Broad College of Business. So welcome to both of our guests today. I'd like to turn it over first to Dr. Hoag. Welcome, Dr. Hoag.
Thank you, Dawn. So my name is Kathy Hoag. I'm a native of Michigan. I was born and raised in the far western end of the Upper Peninsula of Michigan. I have a bachelor's degree in medical laboratory science, and I'm a certified medical laboratory scientist. And I have a PhD in immunology from the University of Texas Southwestern Medical Center at Dallas. I've been here at MSU since 2001, and my primary appointment and teaching responsibility is clinical immunology for the medical laboratory science students here at MSU. Can I have the first slide? So today I'm going to be joining Dr. Susarla in talking about measles and vaccine hesitancy. Next slide, please. So first I want to start with a general introduction of what measles is. Measles is one of the most highly contagious virus infections. And in fact, it's thought that a single individual with measles infection can infect 12 to 18 other individuals if they are susceptible to an infection. Measles is also known as rubeola. It's a virus that's closely related to mumps virus and respiratory syncytial virus. The symptoms of illness are delayed 1 to 2 weeks after exposure to the infection, and they're characterized by a high fever, typically 104 to 105 degrees Fahrenheit, a cough, a runny nose, red, watery eyes, and then about 3 to 5 days after the fever appears, a very characteristic body rash, which you can see in the photo on the right-hand side. Next slide, please. I was asked to talk about why measles is such a big deal. And measles is really most serious when it has complications of the primary infection. And these complications are seen most commonly in children under the age of 5, those over the age of 20 and exposed to the first infection, women who are pregnant. And for the pregnant women, it's really not the problem with them, but with their unborn child that they are carrying. And then those who have compromised immune systems, either due to inborn problem, deficiency in immunity, or due to treatments such as for cancer or following a solid tissue transplant. If you look at what happens in someone who acquires measles infection without prior vaccination, 1 in 5 of those individuals ends up being hospitalized due to the severity of their illness. 1 in 20 children under the age of 5 who acquire measles primary infection develop pneumonia. 1 in 1,000 children develop swelling of the brain, which can lead to convulsions, deafness, and long-term intellectual disability. 1 to 3 per 1,000 children die from the respiratory and neurologic complications. And pregnant women can give birth prematurely or have low birth weight infants. And then these children have the same complications of measles with pneumonia and possibility of encephalitis as young children who acquire the infection as well. And it's currently estimated that there are about 500,000 deaths worldwide from measles due to lack of a vaccine program. Next slide, please. So you may ask, how can I protect against measles? So the measles vaccine is currently part of the recommended childhood immunization schedule in the United States. It's part of 2 different vaccines that can be used in childhood programs. The MMR is measles, mumps, and rubella, and the MMRV is the measles, mumps, rubella, and then varicella, which is a causative agents of chickenpox and shingles. These vaccines are commonly given together because they all have related issues, especially in threatening an unborn child if the mother acquires infection during pregnancy. Next slide. So you might ask, how effective are vaccines? It's currently estimated that 2 doses of the measles vaccine provides 97% effectiveness against infection if exposed in the environment. And this graph from the CDC is showing the incidence of measles infections in the US prior to the time that the vaccine was introduced in 1963. And you can see there were approximately 500,000 cases of measles reported in the US in the early 1960s. And then following vaccine licensing and incorporation into the childhood vaccine protocol, that incidence dropped to about 20,000 by the end of the 1960s. And then we saw a few little blips in number, and that was attributed to the fact that protection from 1 vaccine dose is not as effective as protection from 2. So you can see in 1989, the immunization protocol was updated to have a second dose of the MMRV vaccine administered. And after that time, you can see that the incidence of measles in the United States has pretty much flatlined at usually less than 100 cases per year. And it's been so effective, the measles vaccine has been so effective that in 2000, the US declared measles eliminated in the United States. Next slide, please. However, in the last several years, especially since 2020, we have seen measles cases in the United States increase. And this map is showing you the number of cases reported in the United States since the beginning of 2024. And you can see that Michigan is light blue on this map because we had 4 cases of measles reported here in Michigan in the early part, primarily February and March of this year. And those cases were clustered, 3 of them in Wayne County, Michigan, 1 in Washtenaw County. And there was potential for further exposure and spread of those cases because the patients were seen at either urgent care or emergency rooms in those areas. Luckily for us, those who cared for them and those who were surrounding them appear to have been vaccinated. And there have not been any further cases of measles reported in Michigan since early March. However, you can see that the state of Illinois here is highlighted as having 50 to 99 cases because they have had some minor sustained outbreaks where the measles virus has spread in populations where there were individuals who were unvaccinated. Next slide. You might have thought, as I went through these first individual slides, who in the United States determines the immunization schedule? There is actually a volunteer group called the Advisory Committee on Immunization Practices that meets every year, and they recommend the immunization schedule to the Centers for Disease Control and Prevention. And then the CDC generally implements the recommendations of this committee. This committee is appointed, and they are all currently medical doctors. So they're specialists in medical and public health, and they use published scientific studies, the vaccine adverse registry reports, and updates of outbreaks in the community to improve upon the immunization schedule every year. Interestingly, immunizations now include both vaccines and passive immunity. The updated vaccine schedule or immunization, this schedule for this year was the first time I have seen passive immunity as part of the immunization schedule in the United States. That specifically is for protective antibody treatment against respiratory syncytial virus in very young children whose mothers do not show immunity against the infection. And so that's a very interesting development, and as an immunologist, one that I'm really happy to see on the immunization schedule. Recommended immunizations on the CDC website vary based upon the age of the individual. So there's a very early childhood vaccine schedule from birth to 15 months, which is really aimed at getting the young child's immune system primed and getting them protected against infections that they will be exposed to, especially in public areas such as grocery stores and child care, and subsequently in school. Then there is 18 months to 18 years, other infections that become more important as an individual ages. And so some of the things added there might be the HPV vaccine and meningococcal vaccine for high school students. And then there are further vaccines that get added in adults, people my age and over the age of 60, who began to see outbreaks in things like shingles or other types of pneumonia that the elderly population, those over the age of 60, become more susceptible to. And so age dependent is appropriate for immunization scheduling in the US. Next slide. So a lot of people ask me, where's the best place to get vaccine information that I can really trust? The US Centers for Disease Control and Prevention, the CDC, as it is abbreviated, provides really excellent resources for the immunization schedules. And I've provided the website link right here on the slide. But if we go to the next slide, we can see the homepage of this website. This is what it looks like originally. When you go directly to that page, you can see there are hyperlinks right on the front page for the childhood and adult immunization schedules. They break them down based upon the age of the children or adults. There are additional vaccine recommendations for those who may be traveling to developing countries where hygiene practices are not as stringent here in the US. So things like hepatitis A and hepatitis B for individuals who may not have been vaccinated before would be ones that you may want to get. In addition to just the vaccine or immunization schedules, there's also excellent information on every single one of the infectious diseases that is on that immunization schedule, how they are contracted, what age and population is most susceptible to them, and consequences to the individual who may acquire infection if they have not been immunized and protected. And it is time for Dr. Susarla.
Dr. Hoag, before we go into Dr. Susarla's comments, do you mind if we pause for a minute and ask you a couple of real short questions?
That'd be great.
Okay. And also, I want you to know, Dr. Hoag, we posted that link to that CDC immunization resources page for everyone to have access to in the chat.
Great.
We have just a couple of questions that we have for you, Dr. Hoag, about measles. The first question is, how do I keep my child, or in my case, my grandchildren, safe in school or daycare if I don't know if all the children there have been vaccinated?
One of the great things about the measles immunization is that it is highly effective. Sorry. As I noted during the presentation, 2 doses of the measles vaccine provides 97% protection against infection. So even if you are exposed, the likelihood of becoming infected in that case would be extremely low. So most of the cases, the majority of cases that are seen in these outbreaks are in individuals who have been unvaccinated. Greater than 80% are in unvaccinated individuals.
Oh, that's really interesting when you say it's 95, what'd you say,
97.
97% effective against getting the disease, as opposed to sometimes you hear about effectiveness about like symptoms not becoming so severe, but in this case, it's actually getting the disease. That's exciting.
Correct. Yeah, the vaccine is much more effective than, for example, what we've seen with the recent COVID pandemic, where individuals are protected against hospitalization. That certainly the severe consequences of COVID-19 infection are greatly diminished by vaccination, and that's what we're trying to protect against. But people do get symptomatic disease still following COVID-19 vaccine. That is not the case with measles. They're basically completely subclinical infections and great
Amazing.
protection from the vaccine.
That's so cool. That's great to hear.
Yeah.
Just one more quick question and then we'll move on. The question is, I don't know if I've ever been vaccinated. How can I check what I still need?
Lucky for most of our audience, I would assume, we live in the state of Michigan, and the Michigan Department of Health and Human Services actually has a immunization portal that you can log into. I don't know if I have that handy. I don't think I have that website handy. But just simply Google Michigan Immunization Portal. You'll find it. You can set up your own account and have access to your immunization records at any given time. And then anytime an immunization is given in the state of Michigan, the physicians should be adding that information to that immunization registry.
Nice. And you know what? I think we might have access to that link. So in the meantime, we'll try to put up in chat if we can. How's that sound? Good. Okay. We're about ready to move on to our next topic of vaccine misinformation. But before we do, I just want to do just a quick announcement that we'll be posting 2 surveys during this webinar. One survey, just very short, to see who's listening in terms of the demographics. So that will be a demographic survey. And then the other survey is a little bit of a survey to see how well the webinar met your needs. And so you'll see those coming up in chat too. So perfect. Okay, so now we'd like to welcome Dr. Susarla to us. Thank you, Dr. Susarla, for speaking with us today.
Good afternoon, everyone. I'm happy to join you today. So a little bit about me. My area of research is information systems. I'm at the Eli Broad College of Business. I've done a lot of work on social media and studying health information on social media, the quality of health information, how it spreads, the types of disinformation, etc. And also I study responsible uses of artificial intelligence. That is, how do we actually create recommendation systems, for example, to establish content credibility and authenticity, among other things. Those are all things I study. So let me go on to my slides. The challenge here is social media. I think the studies show that only 12% of adults in the United States have what is considered adequate level of health literacy, by which, let me define some terms. Health literacy is basically how much health information, how much information do individuals possess in terms of managing their own healthcare conditions? As you can see, the statistics are not so great. Only 12% of adults actually have adequate level of health literacy. So what happens then? A significant number of folks go online to search for health-related information. It could be just like Google searches, it could be social media platforms, it could be some of these newer platforms such as TikTok. It could be, believe it or not, people go on Instagram. And there are three components here when we talk about the quality of health information. Who are the people creating the information? What are the characteristics of these messages? And what are some lenses or preconceived ideas that people might be interpreting or understanding health information? And this is a complex process. Obviously, there's a lot of studies on misinformation that show that individuals just necessarily debunking a piece of misinformation or adding some context sometimes does not even cause people to change their mind. So it also depends on what interpretive frameworks or normative frameworks people look at. So the misinformation that's prevalent on social media can be on, it's not just in things like vaccines, it can be also on chronic diseases. It could be also on things like diet and nutrition related misinformation. The FDA has actually announced that they are going to enforce some of these labels more stringently. Misinformation on things like, of course, vaccines and drugs and smoking products is more prevalent on especially these video sharing platforms. The non-communicable diseases is on media sharing platforms as well. For a while, I think Facebook was allowing corporation was allowing some tools where researchers could actually study the spread of misinformation. And it also appears that there is a very sort of sophisticated operation among people who spread misinformation. There is the so-called disinformation dozen, as it were, that a majority of health misinformation, especially regarding vaccines, etc., is just coming from a handful of sources. And there is quite a bit of sophistication with which these messages are designed and spread on social media. And of course, when you're searching for things like vaccine safety and vaccines in children, there are significant number of anti-vaccine messages that can end up in your feeds. What are some best practices for us as individuals? And also, what are some things that we can tell social media platforms that you need to do these things? Next slide, please. What I would say is my own research, I found a few things. For instance, if you're looking at even not just vaccines, communicable diseases, but even for chronic conditions such as diabetes, the most popular videos actually have very little health information content associated with them. And that raises this question of the public is not very well informed about who is doing what. They conflate agencies. Dr. Fauci is head of CDC, which is not the case. CDC makes the vaccines. CDC does not make vaccines. They don't mention something like NIH. And there'll be something like vaccine is not approved when that's clearly not the case. So there's also all these things of distrust, low uptake, etc. And so can we study, in some sense, correlate the popularity of some misinformation in pockets, and is that in any way connected with low uptake with things like measles vaccines, which are really important from a childhood health perspective? What do we understand? And this is why Dr. Vivek Murthy, US Surgeon General, in fact, even said that there is almost health misinformation. What are some normative guidelines for platforms? He told them that they need to stop amplifying known sources of misinformation. In fact, some folks have even argued that we need to deplatform when you know that someone is actually knowingly spreading spurious information about vaccines, then we should not even maybe give them a platform to spread. And this has been a tricky issue in content moderation because that First Amendment gives you rights to broadcast what you like. However, what is not addressed there is that an individual can say whatever they want to say or believe whatever they want to believe. But because of social media, it's almost like a person with a lot of followers is getting a huge bullhorn where they can broadcast their message, which in turn can be amplified and rebroadcast by many individuals. So, what is the question? At what point do we say that First Amendment right is one thing, but that doesn't mean that platforms should not knowingly amplify these messages? Or platforms should be very strict in terms of checking, they need to invest in sort of in policies that, for example, during COVID times, a lot of platforms had policies that had a ban on COVID misinformation, right? Twitter, for instance, what happened in November 23rd, 2022, they just removed, though there was among the buried somewhere in the site's rules page, it's announced that they no longer are going to enforce these COVID policies. So that's the concerning things, because we know, all of us know, that there was some disproven link between autism and MMR vaccine. And that kind of thing has consequences for public health with higher incidence of pertussis and so forth. So in a way, social media, what's the problem? Can we go to the next slide, please? The problem is, how do we identify sources of credible information on platforms such as YouTube? And can we convince these social media platforms to stop amplifying sources of health information, ensure that their recommendation systems and algorithms that are primarily driven to maximize the engagement? What TikTok does or YouTube does is they want more viewers to keep watching. They want people to keep clicking. So it's almost like a rabbit hole. You start watching something, you're recommended some stuff which looks very anti-vaccine, and then you can just go down that endless rabbit hole, and soon it can result in people changing their mind about the efficacy of vaccines and so forth. So the challenge is, how do we find this credible information? And there are well-known researchers, Brendan Nyhan, etc., who've studied this problem also with extremism, online extremism and so forth, where people can become persuaded to believe in kind of racial resentment, or very negative attitudes can result when you are endlessly on social media. So what is it that we can do? Can we study the type of recommendations that YouTube provides, for instance, and almost do like a simulation study in a lab? And can we try to break down this black box of algorithmic recommendations and come up with some best practices, or at least put some sort of caveats? Next slide, please. So what has happened is that there is now at least some public understanding of this problem, but it is on all of us. We all need to be very vigilant and very careful with what sources of health information are we engaging with on these social media platforms. So YouTube, in fact, convened a National Academy of Medicine panel of experts into basically writing, how can we create these health literacy strategies, or what sort of can we identify credible sources of information on social media platforms regarding health. And the project that I've been working on, which is funded by National Institute of Health, my lead guy on this project is Dr. Rema Padman from Carnegie Mellon, who is one of the experts in the National Academy of Medicine panel. So similar to social medias have policies about violent content, or they have policies about what happens to ads about, let's say, smoking, or ads about climate change. There's what happens if you post something which is essentially engaging in climate change denialism. Social media companies have those policies. Now, what is important for us from public health perspective is to make sure that there are those adequate policies when it comes to public health and any kind of communicable diseases. World Health Organization actually has white papers on global principles for identifying credible sources of health information on social media. YouTube has recently announced something like a check mark, where you could apply for If you're a health provider, you can apply for a check mark and say that I am an authenticated health provider. We tried to do, my co-authors and I did an audit study. Now, the check mark for YouTube, it can miss some sources of health information, like some information that is put out, let's say, by the National Health Service in the UK, which is authenticated source. It was not part of the YouTube's content filter, assessing that something is credible piece of content. However, despite some gaps, we found that to be a very credible, it's a very good way of credentialing authenticated content. So the next time you're looking for social media, information on social media, that's one thing you need to look for. Is this a credible source? And that's one of the important things. And the second thing I think that we should all understand, maybe as educators, is that science communication or public health communication is the great challenge maybe in the 21st century. We don't train our scientists to be public educators, but I think now the need of the hour is we need to assess those strategies. There are methods where can we algorithmically do something, design better filtering mechanisms, and also devise our content so that it's more easy to understand. Central problem being the health literacy gap. That's one of the big reasons why we see this kind of popularity of some of these misinformation, because it's also cognitively easier to believe in all the fake news or conspiracy theories or what have you, compared to take 5 ml of this and then do something and then do something else and monitor your health. That sounds too difficult for people to comprehend, too many steps and so forth. That's one other aspect of research that I've done. What makes things popular? If you look at how much credible medical information there is, I've created scales using algorithms called deep learning. Then you can also look at how understandable is something from a cognitive perspective. So take scales developed by cognitive scientists and get annotated data and basically methods. I've basically studied thousands and thousands of videos on healthcare conditions. And the videos that are most popular have very little health information and they're very easily understood. Right? So I think this is what my scientific studies have shown. And I think that's why best practices have to be it's not just, this is such a complex problem, cannot be solved by just one person. We need public awareness. We need education. We need some intervention where we have to work with social media companies. There has to be also maybe some pressure from governmental agencies asking for more transparency, disclosure, auditing, and so forth of these social media platforms. And so that's where I would stop here. This is what my research has shown, and I'm glad to have an opportunity to share some of my work.
Thank you so much. It really sounds like a complex problem that we all need to have a multi-level approach to addressing. I also think that your research showing that the simpler we can make the healthy option, the better it is for everyone, right? That seems to be a bottom line. Dr. Susarla, thank you so much. We do have a question here for you. Here's your question. Looking for the future with emerging technologies, AI readily available, will misinformation, do you think, will that get worse?
Unfortunately, I think the answer is yes, because AI makes it easier to create very credible sounding negative information. So let me share a very sobering sort of statistic. There was a study recently where what happened was a group of biomedical researchers, actually, they generated a lot of fake abstracts of scientific papers using ChatGPT. And then they took a bunch of abstracts of actual published papers in biomedical sciences in very reputed journals. So when these abstracts, if you randomize it and show it to actual researchers, we're not talking about general public, people who are in the field and they have years of training, there's almost, I think 40% of the cases, people were not able to distinguish whether something is created by AI or whether something is actual. So unfortunately, the ease with which misinformation can be created is just creates an extra barrier or extra level of challenge from a public health perspective. I wish I could give a more optimistic answer, but I cannot.
Wow, that is just fascinating and really horrifying, isn't it? Yeah. It's going to be more and more difficult and increasingly important that we really look for credible resources.
Yes.
Fascinating. Thank you so much. Does anybody else have any other questions that we could ask? If so, now is the time to put them in chat. Also, there have been a couple of links put up, one for the immunization portal for accessing your data and one on the guidance from the Surgeon General on identifying misinformation online. And the link is there. Okay, I'm not seeing any questions come across. I do want to give you a quick reminder that there was 2 surveys posted. One of just a general demographics form to see who's listening, and then one called the evaluation survey to see how well this webinar met your needs. Yes.
Could I actually ask Dr. Susarla a question?
Of course.
One of the health listservs that I belong to very recently discussed vaccine uptake, and in particular in the context of COVID-19. And their finding was that promoting empathy for others in society was probably one of the best ways to promote vaccine uptake. Have you seen research on that in your studies?
No, I haven't seen about empathy, but that would be interesting. The challenge is, I think, if you're talking about social media platform, the scale of the problem is so huge. So I do wonder, how can you measure that empathy from an algorithmic perspective or from designing some scale? But yes, I guess this is the challenge. What works in maybe one-on-one situations is so different from what can be easily, I think, scalable in this online setting, and what goes viral or what becomes very popular. And
the underlying principles of an immunization program in any country is the goal of achieving herd immunity.
yes,
You know, we're really talking about somewhere at a minimum 85 to 90% of those of the population being protected by vaccination in order to prevent an illness from spreading within the population. So I would be very interested to see if the public health would promote more of protect those who can't protect themselves as far as the philosophy for promoting immunization protocols, because that's really the whole goal. And I think that message may have gotten lost since the advent of these immunization programs.
Yes, I think you make a great point. And I would say that it's a little bit of, for instance, the social media platforms too, in all their, how do they devise algorithms that kind of make content more popular? Is there some sort of a audit study or something that looks at essentially what happens to the person who is very immunocompromised or their impacts on their lives? And can we do something from a policy perspective that would protect the folks who are really the most disadvantaged? That calls for, we need to really recognize that these algorithmic harms exist. And I think conversation has not really gotten to that point, unfortunately. But we need a clear mapping between this is what happens as a result of these policies, and if platforms are not investing in transparency, they're not investing in content moderation, then you will have these negative consequences in society. And we need.
Have you gotten a feel for whether the US government is like the FDA or the CDC is willing to step up and try to regulate these platforms? Because we have there is the right of free speech to the point that it's limited if you're in a crowded building and you yell fire and people are trampled to death. Is this not a similar scenario where people are spreading misinformation that is leading to the death of others?
Yes, you're absolutely right. And the question is, how does the National Academy of Medicine initiative is the most heartening thing that I've seen. So I will make one observation. I think that social media regulation, at least at the level of the US government, maybe that's a little challenging, but individual states have actually they've at least taken some steps, or they've at least, the California Attorney General, I remember before some elections in California, sent these letters asking for some information and more authentication type of provision. So I think we are seeing piecemeal efforts, not something holistic. There is more, maybe from perspective of Europe, there is a little bit more regulatory focus on just having more responsible use of artificial intelligence everywhere. So this is something I do wonder in the next 5 years what will happen. But there is some awareness of these issues. It is just that, unfortunately, I think COVID has led to a sort of a distrust maybe in public health guidance. And so now we have to assess in light of all these things that are going on. I know that the Supreme Court actually rolled back. Some Biden administration had some provisions in place where social media companies, you could have more scrutiny. But I think that was Supreme Court sort of said that's not allowed or something. So there are all these things. I think there is one case before Supreme Court, which is Murthy versus State of Missouri, and Vivek Murthy, the Surgeon General. So I would think we have to watch these cases closely to see what would be outcomes from public health perspective.
Very interesting. Yeah, it's certainly something we need to watch in the future. We did have a couple of questions come in. And so actually a couple of questions for both of you. Mm-hmm. From the social media perspective, one question is from a personal aspect: how can I talk to my kids and my parents about misinformation on the internet and how to make them more aware?
I would say the same thing that I've said so far. I think we should be a bit careful about who is the content creator, from where is this message coming from. So we cannot be too credulous about, this is an engaging video on TikTok I just saw, or Instagram reel, and it's fun, it's nice. But is this really giving me the facts? I think facts are something different from watching some engaging piece of content.
Yeah, and maybe we can work with, especially the kids, practicing, figuring out, is this credible or not?
Yes.
Yeah, good. The other one on social media is, are there some social media platforms, Dr. Susarla, that you think are worse for misinformation than others?
Yes, I think Twitter has actually, because they've announced that they will not enforce their own policies. So it used to be a good sort of a platform, but now there are some challenges. And actually, let me share in the chat. Can I share it to everyone? Yes. This is an article I've written for the conversation. And in that, the folks at the conversation have a link to a video produced from PBS about how to spot misinformation online. So that may be helpful. The article itself has some guidelines, and so we have to be wary of consuming content online, even though we spend so much of our lives online and on social media platforms. We should also be a bit skeptical about what we see and what we believe and what we are being told.
That's an important message. Thank you. And then Dr. Hoag, a question for you. Is measles something I should be worried about because I'll be doing some international travel this summer? So related to international travel, is measles something I should be worried about?
It really depends on where you're traveling. More developed countries, if you're in Europe, I would say the situation is pretty similar to the United States, and they've had the vaccines in place for quite some time. If you're going more off road to more developing or recently developed countries or more remote areas, there would be a greater risk of measles exposure. But then again, you have the option of having your vaccine status updated prior to travel. So I would recommend looking at the travel site of the CDC, and they have great information about which countries in particular, what infectious diseases you're at greater risk of, and you can go to your county health department to get updated on any vaccines that may have either waned in their efficacy or that you've never had because that infectious disease is not a risk here in the United States.
Thank you. And then one more question for you, Dr. Hoag. This person says, I heard from the WHO that the measles vaccination has saved nearly 94 million lives in the past 50 years. Does this make it one of the most important vaccinations we have?
Wow. What immediately popped into my head was polio. I think polio vaccine would probably give that a run for its money as well. And simply because polio had such a great impact, smallpox would be another one, right? Smallpox has pretty much been eradicated worldwide by a vaccine strategy because there is no environment or animal reservoir for smallpox, so it cannot be transmitted in the population outside of human population. So I think there are some similarly impactful vaccines. I don't think measles is alone in that regard. I think CMV would be another one. CMV is actually much greater incidence of causing congenital infection and long-term morbidity and mortality if acquired by pregnant women during pregnancy. So I think I would love to single out measles as being the best, but it's really hard to argue for some others or against others.
So we really need to vaccinate against all the different communicable diseases, not just single out one.
They are included in the immunization protocol because they cause significant morbidity and mortality, and they're a public health concern in the United States. And I think our society has really lost sight of that because I've never seen anyone who had polio or who had the impact of long-term disability due to polio infection. So I think in people of my age and younger have never seen the impact of these infectious diseases. And in fact, measles is one of those that a physician should be able to diagnose just by seeing the rash and the spots in the back of the throat of someone with measles. It's pretty characteristic. But most physicians now have never seen it because our vaccination, our immunization protocol is so effective. And so we're needing to rely on diagnostic testing again to really verify a measles case simply because even our physicians have not seen it in so long.
Vaccinations are a true success story.
Yes, they are.
Wonderful. I want to thank both of you so much. I don't see any other questions coming in. It's been such an interesting and helpful discussion today. Thank you so much for joining us. Have a wonderful rest of your day.
Thank you for inviting us.
Thank you for inviting us.
Thank you.
Bye.
Be sure and fill out the evaluation before you leave. And thank you, everybody, for being here. Bye-bye.